Hi, it's Kim Liana. Last week I visited here at CSA for my pimple mark treatment and had my lips enhanced. As you can see, the mark has improved and my lips look great. Today I'll be having a combination treatment, Hollywood carbon laser and fillers on the sunken part of my forehead. Don't forget to like, subscribe, and hit the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's welcome back Miss Kim Liana.
Hi!
There. So, last time we did the so-called lip filler improvement, whereby we did the balancing on the upper and lower lip and also balancing of the right and left upper lip. Okay, so I was looking at Liana right now. There was an improvement, and the left, which was narrower last time, was kind of widened right now. Although a little bit of some pinpoint bruise because we just did it 4 days ago. Yes. And another one that I was checking was on the forehead region. Okay, it was just 4 days ago. It was like a so-called PIE, and the intensity of the PIE had reduced already with the use of our device, Hollywood Spectra. So we did a laser toning to kind of reduce that post-inflammatory erythema. And looking at her, and she also noticed that there was this improvement and reduction already, right?
Yes.
Mga ilang percent palagay mo, Kim Liana? 30%?
50.
O, sa kanya, 50%, okay? So ako, I'm saying 30%. And we're still giving like a 1 week, 2 week period for this. Actually, intervals of treatment for this kinds of like treatment of a certain PIE or PIH, we give like a 1 to 2 week interval, specifically using our laser toning parameter or mode. Okay. So for today, actually I was assessing her again because I noticed last time, okay, there was kind of like a depression, right?
Yes.
So it was a little bit sunken, okay, and it's not already balanced on the surface of the skin. So I was sharing with Kim Liana that when you have a depression, so meaning to say there was already like some skin tissue damage from the inflammatory acne that happened before. It could have been like a dermal injury already. So to improve that, to restore the evenness on the surface, to make it balance on the surface, okay? So, para wala yung irregularity or yung depression like that. So, we can restore it with our dermal filler, okay? So, last time we did dermal filler into our lips. So, what we can do today is to inject soft, low molecular weight type of a filler because we have the forehead section. It has thin tissue. So, we only need a thin filler. And another thing, it's in this area whereby we have like a danger area there because of the presence of the supraorbital and supratrochlear vessels in the inferior aspect on the eyebrow region. So, what kind of technique and what filler are we going to use? And what else can we do for Kim Liana today apart from improving the PIE on the forehead region for the entire skin? Because I was noticing her skin, still she has some blackheads on the nasal region and some uneven skin tone, okay? So what else can we do to rejuvenate, to maintain, to keep the pores really tight, and also prevent further the development of some acne? We'll show that when CSA Medical Aesthetics return. And we're back. So right now, we have Kim Liana here. She has already the so-called carbon lotion. Okay, we applied it a while ago and we left it for about 15 to 20 minutes to kind of let the carbon lotion seep into the pores. Okay, so the kind of treatment that we're doing is the so-called Hollywood laser peel. Okay, so we have the device here and we switch it on. Okay, so this kind of Hollywood laser peel is a 3-step laser peel process, and it makes use of this carbon-based spectra lotion, and it has this 2 different operation modes in your 1064 wavelength. Okay, so the first mode, we use the so-called spectra mode with 300 microsecond, okay, in terms of the pulse duration, as well as also the so-called Q-switch mode with 5 nanoseconds. Okay, so it's a 3-step process. Okay, the first step is actually stimulating the skin by gentle heating, making use of the spectra mode, and the second step is the so-called Q-switch, which will induce the so-called exfoliation, a mild epidermal exfoliation and resurfacing. So very precise, right, Kim? Okay. So excited si Kim kasi her problem of like sometimes she still get this inflammatory acne or inflamed acne. She gets comedones, blackheads, even whiteheads. Okay, and she has also a concern of like rosacea, or her skin is prone to redness. Tama?
Yes.
Okay, so this kind of treatment, the Hollywood laser peel, is indicated for those with inflammatory acne, skin redness, and also it's for skin rejuvenation, and also with those people who has concerns on large pores. Okay, so rejuvenation, enlarged pores, inflammatory acne, and skin redness. So our step 1 is using the so-called spectra mode. Okay, so we'll be using the 8mm spot size. It's already 8 and a 5 hertz there, and a fluence of 0.9. Okay, so since we left the carbon lotion for about 20 minutes, right, Kim? So I'll start with this kind of mode, and we have the handpiece here, and then the foot switch. Okay, so this one, the first one, is using spectra mode, 1064 wavelength, and it's just gentle heating. Okay, so there you go, it's creating moist, and I'll start with the lower part of the face. So kind of like there's a sensation of some heat, Kim?
Yes.
But it's okay, right? So this one is just a single pass, and we're targeting the area with this carbon gel and going to the forehead region. So our concerns of having this acne or redness will be targeted by this kind of procedure. And we'll go to the left side. It's a painless treatment, no, Kim?
Yes.
And it's relaxing actually. It's soothing to the skin, right? So you are relaxed and you're beautifying, and at the same time, this is pampering your skin and treating those concerns of like acne, rosacea, and it's also anti-aging, rejuvenation, because it also improves skin elasticity. Okay, I'm done with the first step. The second step is now switching to the so-called Q-switch mode. We had the carbon lotion, there's gentle heating. We wanted the carbon lotion to really adhere to the superficial layer, okay, to the epidermal layer, and induce the so-called mild epidermal turnover. Now, the second step naman is already stratum corneum exfoliation. So, you're sloughing off dead cell layer. And at the same time, you slough off some of the epidermal debris or some of the epidermal pigments with it. And also, you're contracting the skin pores. I like that. You're tightening the skin pores too. Okay, that's the second step. So now we'll be hearing some loud sound here. That's normal. So this will explode the carbon particles. I start with the lower part of the face. So we'll be using the so-called 2 to 4 passes here. So now you will see the carbon fading. So it's gone already, okay? So we're taking off the carbon already. The sound is just loud, but it's not painful. So if you notice, the carbon gel is already going away. Close eye. You're okay, Kim? Doesn't hurt, right? So we're passing through your upper lip and then the nose with the carbon lotion. Just close eyes. So we'll just do a second pass again just to make sure we cleared all the carbon lotion. End point will be the so-called mild erythema. If you notice already redness, that's an end point. But you feel some heat, Kim? Not really, okay. So she has the PIE on the forehead. Left side here. Okay, so we're almost done with the second step. We're just clearing the remaining carbon lotion just to make sure that's totally clear. Okay. So we have done the first and second steps. Let's proceed to the third step. It's the Spectra 1064 again, and we'll use the Fluence 2.4. And we're having the spot size 8mm with 5 to 10 Hertz. Okay, so 2.4. And we'll press the standby. So this third step right now is like further improving the skin condition. Actually, this one will tighten sebaceous gland or contract the sebaceous gland and also improve skin elasticity. So we can do multiple passes. You just repeatedly irrigate the skin, okay? Irrigate the target areas, and we are inducing contraction of the sebaceous gland, right, to prevent acne. And also we want to increase the skin elasticity, so it's also anti-aging, it's rejuvenation. So somehow you're helping with the stimulation of your collagen. So this is a prevention for the aging process, right, Kim? So we can do multiple passes for this one. Now, the advantage of the Hollywood Spectra over the other devices there is the so-called hyper surge beam. Okay, actually that one helps in the faster tissue healing, faster tissue repair. Because if you notice, it's like the beam here is like there's a surging, hyper surge, okay? So this kind of device, it's the latest in terms of our Q-switch lasers here in our center now. So the Hollywood Spectra is already the upgraded type of those Spectra devices. So if you compare it with the conventional Spectra lasers, this one has additional handpiece we call the MDF, or the multi-depth focus handpiece, whereby that one treats also those with acne scars or those with deep lines and wrinkles. Okay, so acne scars, those who want to have dermal remodeling, okay, even stretch marks, deep lines and wrinkles, so multiple applications. Also has the gold handpiece, which is for vascular conditions, vascular pigments, as well as the ruby handpiece for pigmentations. And even it has treatment for tattoo, any color of tattoo, also those epidermal pigments, epidermal melasma, dermal pigments, dermal melasma, and also your birthmarks. We have your pigment birthmarks and the so-called vascular birthmarks. So many applications. Okay, so those with problems of severe melasma, this is a device that's very safe for you. So we've done multiple passes with our third step already. That's it. So we have done the so-called Hollywood laser peel. Then we'll proceed to the injection of the depressed PIE, or the depressed mark on the forehead region of Kim. So we'll now proceed to the treatment of this sunken mark here. This was from the inflamed acne. I guess it was a cystic acne, right, Kim? 2 months ago. And Kim self-medicated with a strong tretinoin, 0.1%. She applied it on the area, causing the burning of the skin. So we now have this depression here. Although I've done already the laser and it had reduced the pigmentation, okay, but because there's this depression in the area, we also need to improve that, okay. So when we do injectables, we have to do it after doing a laser, okay. So we had the laser, and then we can do the injection in the dermis layer of our soft molecular weight type of product, okay. So I'll be using a cannula in this region, okay, and we know that we have the supraorbital and the supratrochlear blood vessels here. So we want to protect those vascular tissues by just using our cannula device, okay. And I'll be using a low molecular weight type of a hyaluronic substance, a thin type of a filler. Since I'll be using a cannula, I'll be needing an entry point, and so I have a gauge 25 here, and I just need to fill in this area here, and I'll be using a so-called fanning method, and I'll be injecting only a minimal amount of this product here, okay. So ideal to also prime your product, okay, and inject into that entry point and deliver it into the depressed area, okay. So I'll just hold this and glide. Now basically the anatomical layer here when I do my dermal filler, so considering I'm within the 2 centimeter distance from your supraorbital, supratrochlear, since we know that the vessels here come out like on a deep plane, and as it goes above the 2 centimeter, it goes on a superficial plane. So in this region, we can somehow go on a supraperiosteal plane. Okay, and I am using again a so-called cannula, a device that I use to deliver my product. I'm just slowly advancing my cannula, okay, since we are in a danger area. So we have to be very careful in delivering the product, and I'll only deliver a minimal amount of this because we have a hydrophilic substance which attracts water. So we have to limit the amount of or the volume of filler that we will use. Okay, I'm just gentle in advancing. As much as possible, we want to minimize any tissue trauma here. Okay, you're okay, Kim? Yeah. So if you notice, her skin has some mild redness from the laser a while ago. Okay, so the advantage of that, it will help in also improving her skin texture, skin quality, also prevents acne, and also will improve those pigmentations, so it leads in skin brightening. And we also want the skin rejuvenation, and we've mentioned that it improves skin elasticity, so it will lead to skin tightening and firming. Okay, so I'm just so slow in pushing this material. Okay, when I do the forehead region, as much as possible, I take time because we know that there are like blood vessels in this area, and the supraorbital and supratrochlear are branches of our ophthalmic arteries. So they're from the eye area. Okay, Kim? That's why I'm just very careful. That's why it's really important that you go to licensed physicians who are trained to perform aesthetic procedures or the so-called minimally invasive aesthetic treatments. Okay? Is that clear, Kim?
Yes.
Do you have any questions, Kim?
No,
Something?
no.
Okay. So you're okay, right? So Kim trusts me that well. Okay. We've been together already. We've done several treatments for her. A lot of injections already were done. So she's already kind of like she has peace of mind. So she doesn't worry anymore. She doesn't have any anxiety. As much as possible, we wanna be calm and not be anxious. And then after doing your filler, it's important that you massage to spread the material. And since you have a hydrophilic substance, it attracts water. This one will further improve any pigmentation, Kim, okay? So it will lighten the skin. Because if there's a depression and it creates like a dark shadowing from the reflection of the light, and you look at it as like a pigmentation, when you fill it in, your skin is stretched, right? And when you stretch the skin, you lighten it. You minimize that dark shadowing. Okay, so we have done the injection of dermal filler on this forehead region, the sunken mark from acne. We'll show the outcome to Kim Liana when CSA Medical Aesthetics return. And we're back. So we'll show the result to Kim. And here's our mirror, Kim. Okay, you can check on what happened to your face after the Hollywood laser peel and also the filler injection on the forehead region, specifically the depressed area from the pimple mark.
Yes.
Okay.
Nawala na talaga yun.
Exactly. So I'm looking at the forehead region right now of Kim, and a while ago it was really sunken a bit, so it was hollow a little bit. And right now, because we injected like 0.4 ml of our low molecular weight filler, we were able to elevate it, and we were able to correct the depression there. Okay, so for those with concerns of like areas on the forehead from, for example, from acne and there was a depression there, So a quick fix is this filler injection. Okay, so instantly you've seen already the improvement, and you can already appreciate the elevation of the skin, and somehow we improve the convexity of the forehead region. So ideally, it should have that smooth shape, smooth surface, and a convex shape. Okay, so it should not be a concave. So hindi dapat lubog. Kasi the others you're seeing on the upper forehead, there's this projection or elevation, or like it's a forehead bump or bulge. And then as you go down, you notice there's already a depression there, or a hollowness there. Actually, as we age, you'll notice a so-called soft tissue atrophy here. An atrophy of the tissues in the lower forehead region, or the upper part of the eyebrow area. And some people will notice they already have these static wrinkles here. And the thing is, the static wrinkle we cannot inject. In this part specifically, we cannot inject Botox. Because when you inject Botox here, this is a no-go zone for Botox here, it will cause a so-called eyelid ptosis or brow ptosis, because we have a muscle that opens your eyes. That's why here we can correct with our dermal filler. It's a quick fix. It gives an instant result and a further improvement. Plus, because it's dermal filler, it's hydrophilic, it attracts water, so it will stretch the skin, and at the same time, lighten any pigmentation. Okay, and also some collagen stimulation there. There you go. How was the Hollywood laser pill? How was the experience?
No pain at all po.
Painless, right?
As in, wala po.
It was relaxing.
Makakatulog pa po ako.
Yun ang gusto natin.
As in.
Makakatulog tayo. While you're rejuvenating, you feel so relaxed. Good hormones are coming out. Happy hormones are coming out. It's good for your skin. Skin regeneration, skin rejuvenation. Plus, I love the effect of it, like the contraction of the skin pores, or the tightening of the skin pores. So for those who have problems of enlarged pores, and also acne-prone skin, and you have sensitive skin, red skin, this is also a remedy. Okay, apart from, of course, rejuvenating, treating lines, wrinkles, sagginess, laxity, all of the above na. Okay, it's treating multiple concerns on the face, and I should do it later on. Okay. And I noticed, nag-smoothen yung skin niya here on the nasal region, because a while ago it was rough, and you notice the blackheads are so distinct. But looking at it right now, it's smoother, it's finer, it's better. Okay, so it's painless, and I could see an instant result. You can do this before any party, events, activities, wedding, or any gatherings or social events. No downtime. Okay, so very perfect for those who have events and photo shoot. If you have photo shoot, video shoot, whatever shoot. Thank you, Kim.
Thank you so much.
Yeah, and hope you learned something from this episode, and we were able to help Liana again. Thank you so much, Kim, and thank you so much to all of you. If you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. If you want to watch the other videos where we highlighted treatments of Kim Liana, you can just check out our YouTube channel, Contessa Salvador. And please do click subscribe. We totally appreciate you watching our videos and hope you're learning something from this. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.